A 22-year-old medical student discovers a firm, mobile lump in her breast and fears cancer. This lump, often referred to as the breast mouse, is a reminder that not every breast lump is malignant, but every lump needs a thorough triple assessment. Understanding benign breast diseases is crucial. These conditions are more common than malignancies and often stem from the terminal duct lobular unit. The concept of ANDI, or aberrations of normal development and involution, helps classify these benign variations. Common benign conditions include fibroadenomas, breast cysts, mastitis, and duct ectasia. Symptoms may include pain, lumps, or nipple discharge, with signs like the smooth, mobile nature of fibroadenomas. Investigations involve a clinical exam, imaging, and pathology to ensure accurate diagnosis. Management can be conservative, surgical, or involve aspiration, depending on the condition. It's essential to be aware of potential complications, including secondary infections and psychological distress. Remember, while benign breast disease often requires reassurance, vigilance is key, and the triple assessment is the gold standard in care.